probably seen these $0 perk ads everywhere. Free dental, vision, and hearing. But the question is, are they a trap? Memaw always said, if it sounds too good to be true, it probably is. I've helped over 500 families with their Medicare avoid these traps. And today, I'm going to help you too. We're going to learn the 3 biggest hidden costs inside these $0 plans and the biggest red flags to watch out for when evaluating them. The smart way to choose a Medicare plan so you don't fall into one of these traps. And finally, the huge golden ticket that you get once in a lifetime to get anything you like without health questions. So with that, let's get right into it. The mistakes to avoid in these $0 perk plans. So let's dig into it. What is the first cost of a $0 plan? Turns out, freedom. Freedom is the first cost because they put you in this box called a network. When you're in a $0 plan, it's called an Advantage plan. And all of these Advantage plans are either an HMO or a PPO. That's a network that you have to stay within. So that means it's like having a hall pass that you need in order to go see the doctor that you want to see. And in some cases, they'll say no. Like for example, let's say you wanted to see the Mayo Clinic. The Mayo Clinic does not participate with any of these Advantage plans, so that would be a no. Or let's say you want to go to some other specialist, maybe in a different town or something, find out they don't participate. So the first cost is being in this box called a network, and that loss of freedom can be a big cost for some people. The next cost of a $0 plan is the actual maximum out of pocket. Okay, so here's the way it works. Within these $0 plans, it's not $0 for all services, right? It's just $0 for the monthly payment. So if you have a cancer, you owe 20% of all your chemo costs. Same for dialysis, or if you need medical equipment. Hospitalization has a daily cost in the hospital, outpatient surgery. If all those costs add up to a certain amount, right now it's about $8,550, right around there. That's the max out of pocket for most. So if you get to that much, yes, the carrier in the Advantage plan is going to pay for everything after that. But that $8,550 is a ton of money. And let's say this life thing that happens to you that causes you to have to pay this much out of your savings happens late in the year, like November. Well, then you start the year over and you've got to pay another $8,550 before the plan is going to pay for everything again. That can be a catastrophic financial risk for somebody on a fixed income with fixed limited savings. So let's take a look at the alternative, all right? On this side, we've got the Advantage plan. This is the $0 plan that has the free dental, vision, and hearing. On this side, we have what's called a supplement plan. Now, we see right away, this one has a $0 per month, as we know. This one has $125 a month. Okay. This one has a $257 annual deductible you also have to meet. So over here, let's say we've got a scenario where we have a major catastrophic scenario in life, like a car wreck or natural disaster, storm, tree falls causes us something, or even a heart attack, right? So something not in our control causes a major situation. On this side, the Advantage plan, our liability is that $8,550. You're going to eat up to $8,550 before the plan pays for everything. Over here, no free dental, vision, and hearing. You're not getting those free perks. But this car wreck happens or this other natural disaster, here's how it's going to look. You paid $125 a month for 12 months. We know that's going to happen. That's $1,500. And then you got to pay that $257 deductible, and that's a total of $1,757 for the year, 1,757. Let me clean that up a little bit. Right there. So let's compare this number to this number. That is a huge difference. Many thousands of dollars difference between 8,550 and 1,757. So it's true, you paid more per month inconveniently, I'll agree. But the overall savings here, you owe nothing, right? This plan is going to cover you at 100% inside the hospital, and outside the hospital, your maximum cost is the $257 for the year. So this one also has, very importantly, no network. No network. So this is a more comprehensive coverage, and naturally you're paying more per month as a result. So that's the way you can go if you prefer not to have network situation and so forth. However, you can only go that way one time in your life without health questions. And that is your golden ticket to get a supplement plan. These plans typically will make you health qualify. But when you're turning 65, you've got a one-time golden ticket to avoid the health questions. And it actually starts not 3 months before your birth month, but 6 months before your birth month. So up to 6 months before your 65th birthday, you can apply for and lock in the rate for your supplement plan, which is very smart to do. The earlier you lock in the rate, the better. So that's the one way that you can get a Medigap plan without getting locked out forever. A big mistake I see commonly is people take the $0 plan for the free perks. They don't realize it's not as comprehensive medically, and then later realize they're locked out of a Medigap plan because they can no longer health qualify. They can't pass the health questions. So here are the key questions to ask when you're choosing a Medicare plan to keep from falling into some of these common pitfalls, okay? And when you can do your assessment for yourself to compare apples with apples. 1, what is the maximum out of pocket, right? We've seen these Advantage plans have currently $8,550. It's going up. So look at the plan that you're considering and then compare that to the supplement plan route. 2, are the doctors and facilities you're wanting to see in network? Big deal. A lot of people jump into $0 plans. Someone put them in that didn't check the network for their doctors and so forth. You always want to make sure if you're going to go that route, they accept it. Also, ask your doctor, which of these 2 routes do you prefer? Lastly, what is the monthly payment? So we want to know what is the monthly payment, but lastly, we also want to know the total costs, right? Total costs, so that we can do an evaluation like we did here, where we're not only seeing the monthly payment, but also the total cost for what you might owe for the year, right? That is how you can do a better apples to apples comparison to ensure that you make an educated decision. I do that for people. If you want to reach out to me, I'll do that comparison for you very quickly on the phone. Also, I have a free Medicare checklist you can download that will help you kind of do this for yourself as well. Just see in the description below. And lastly, if you want to keep learning on mistakes to avoid and the best ways to choose a Medicare plan, click here and you'll see the next video that I have of this teaching series that'll really help. All right, I'll see you on the next video or give me a call today.